Unmuting. Press *6 or #6.
If you look at age, studies have not gone low enough. Right now, there's no data showing an increase or changes in psychiatric disorders depending on age. With neuropsychological outcomes, it's pretty clear that the younger the child, the worse the neuropsychological outcome is, so memory and attention. That's not been the case in psychiatric disorder. Maybe we could look at it a little more carefully and see the severity of the psychiatric disorder, not just the rate of the psychiatric disorder. But that's been pretty obvious. The risk of psychiatric disorder is high no matter what, no matter age. Gender. There have been, when you subdivide the new psychiatric disorders into, say, anxiety disorders in females, there's been a higher risk in females for developing anxiety disorder, and that may reflect rates in the non-TBI population as well, where females may be at higher risk for anxiety.
David Brent, University of Pittsburgh. Thank you for your presentation, Jeffrey. I have questions. The first is, in your studies, were these all first injuries, or some of them had prior TBIs?
Children with previous TBIs were excluded in all these studies, and that includes those with child abuse, even when there are no documented head injury, because child abuse there's many unreported TBI.
Thank you. I think the second question is more of a contextual one, which is we're struggling in this committee to, there's much more research on TBI than there is on sports concussions. Now, usually where you've looked at both, to what extent, based on your experience, do you think that we can take the mild TBI and apply the sports concussions? And to what extent do you think that, based on background or other characteristics,
one way to answer that is that sports concussion has opened my eyes to the fact that I was doing a great thing by including children who were treated in the emergency room and discharged, because therefore I wasn't missing perhaps 10% of the with mild TBI. I'm realizing that most of the adolescents with sports-related concussions are not even seen at the emergency room. And so now I'm scratching my head and wondering how those kids can be included. I think that, I'm not convinced that they're different. I think that there may be some differences in the rate of psychiatric disorder in sports participants, but I'm not sure what the data or how that pans out. It would be worth looking at. I've read in the distant past that people participating in sports use drugs at a lower frequency, and alcohol at a lower frequency. They're more affiliated, and therefore they have a lower risk of having a psychiatric disorder. That may influence outcome, because the injury psychiatric disorder in some studies influences outcome. So at this, I would say we have no choice but to consider the broader range of mild TBI and apply that to concussion. But if not for the news and sports concussion being in the news in this meeting, it's taken me 20 years to do count of how many are sports related. And I think if you look at the literature of my own papers and my colleagues, the definition of when it's the cause of injury, sports is usually not on that list. It's covered up falls or some other blow to the head.
Third question.
I did. I was looking to see if we still have time. But
question quickly.
Do you have any data on suicide, suicidal behavior as a consequence of TBI?
On depression, I've not had a suicide. I can do anecdotally of within the studies. There's some children. One of my first subjects was very dramatic. Had suicidal ideation. A healthy, well-adjusted 6-year-old who had a DI was suicidal for several hours. Very disturbing to the parents because there'd been suicide in the family. And we had them for 2 years, even though this kid was completely better after 48 hours. That is a very, very scary. That's anecdotal. We have major depression. We've published some findings on hospitalized children with mild to severe injury, and their lesion correlates, depending whether the depression is current with an anxiety disorder, comorbid with an anxiety disorder, or not. But specifically for your question, nothing on suicide.
Thank you.
Okay. Thank you. And Dr. Max, thank you very much.
Thank you.